So we're going to talk about what is prostatic hypertrophy, which is benign prostatic hypertrophy, which is, when men have problems with their prostate. We're going to talk about what are the risk factors, what symptoms do they complain when they come into my office. We're going to talk a little bit about the history when I interview a client. We're going to look at some of the tests, and we're going to talk about the latest medical and surgical treatment options for prostate, for benign prostatic hypertrophy. So the prostate, really, if you look at that, it's a little tiny chestnut right there, and it's situated at the bottom of the urinary bladder, and it surrounds a portion of the urethra, and it also secretes a thin milky fluid that nourishes the gland and helps to activate sperm production. And some of the disorders that we can see is that this is a disease of older men. However, we have had men in their 40s who have started to complain about their prostate. It causes, what does it cause? Bothersome lower urinary tract symptoms. So when men say, oh, you have to go to your pap smear every year, we'll say, don't worry, we're going to catch you at 40 or 45 with your prostate. And it's the second most common surgical procedure in older men of 60 and above.
Let me ask you this question, because it's almost like the problem can almost be inevitable. What is the prostate, just from the age of it, or?
It's an age-old disease. And that's why we're telling men to come in their 50s and get their prostate examined. Because we see a lot of men that have not come in on time, and they've gotten their PSA, which is that the prostate serum is up, and it could signify some cancer. So it's like a woman coming in and having her pap smear.
Right.
If she doesn't come in for a long time, and then all of a sudden she has this abnormal bleeding, we're going to start to think maybe it's probably cervical cancer. So the earliest that you treat and you look and you evaluate, the earliest you will prevent from having prostate cancer.
Okay.
Yeah. So how does the prostate function? Of course, it has a specific antigen. The fluid is what we're testing when we do an exam, and the PSA, which is the prostate serum, actually breaks down the semen into sperm, and it can be measured in the blood, and it indicates the activity of a healthy prostate. So when we do a serum prostate, that's what we're measuring. So enlargement usually happens to, I would say, the majority of men, 90-95%. It can be non-malignant because it starts to grow a little bit more, and of course we start to see the growth of the prostate in the third decade of life, and it continues to increase as we age. Sorry, Sean.
Oh my God, what am I before now?
See what you got to look forward to.
So let's look at the normal prostate, as you see on the left, and the enlarged prostate, right? It's a non-cancerous growth of multiple cells in the prostate, and the process of growth, of course, as these cells start to multiply, is called hyperplasia, and it is benign, which means it's not cancerous.
Is it
So
that's just a normal process?
A normal process.
Yeah, I was going to say, that's just, the enlargement just will naturally come with
as we age.
And it doesn't necessarily signal cancer.
No, it does not.
Okay.
Does it happen to everybody?
It happens to all men.
Okay.
And in the old days, when these was not, this information wasn't prevalent in like we have it now. So you could see my grandfather. They all die of very old age.
Mm-hmm.
They didn't have prostate cancer, and I'm sure that this all applied to them. So what's the difference now that we see more of this?
I think we're catching it at an early stage. Perhaps these men that lived into the ripe age of 91, 92 did not have the chemical exposures that men have now.
Yeah, I was going to say
the
the same
smoking
thing.
and the drinking and the
What's in our water,
health,
what's in our food.
the unhealthy habits that we have now.
Mm-hmm.
And they ate from the earth, and they ate real meat from the cow, and they were farmers. A lot of them, had healthy living. They didn't have this.
Does it have to do anything with sexuality?
It can affect the sexuality. We're going to talk about that.
Okay.
That's interesting.
Yeah, because of the sperm production. Okay, so benign enlargement actually decreases the lumen. And lumen is like, this is the urethra, so it decreases the lumen, right? So if it decreases the lumen as you're going to urinate, it makes it tighter and tighter and harder for you to actually have.
So you can't pee.
Exactly.
and he doesn't
And that
hurt.
doesn't, that has to be uncomfortable.
And that's uncomfortable because, you know, one of the pleasures that they have is able to stand up in front of the urinal and pee. They're
Right.
happy when they can pee. And they can pee well. But when they have a hesitant that they have to stop and go, then that doesn't make them too happy.
Can I tell you
Now,
a
what's
funny
the difference
story?
between that and the fact that you pee, but there's still in the urethra, there's still pee, and it doesn't come out until later. Even if it's not you don't want to get it out, but it's just
Yeah, it's
does
just
it-
not releasing.
it's not
It's
releasing.
not releasing. That's part of the benign hypertrophy.
Oh, really?
Yes.
Wow.
Because
Does
you
it
should be
assi-
able
does-
to pee and pee normally. Let that pee out like when you were a teenager,
Right.
because you didn't feel like you had to go back and pee.
Right.
But if you pee and then you still feel like that bladder is not empty and you have to go back,
Does it assimilate in the body, the urine then?
no, it does not.
So
It's
can
just the
the,
bladder starts to grow a little bit more, gets more uncomfortable.
because it always has this,
This obstruction with the lumen, you know,
Mm.
as the gland starts to grow, it blocks the pee
Yeah.
from getting through.
you know, my father-in-law, may he rest in peace. I like to say that for our faithful departed, right? So when my boys were growing up, you know, we have a backyard. So the little boy got to pee, you know,
Hey, go to
pee in the grass, right? My father-in-law used to just love, because they were, you know, they were peeing, hitting things, you know? And I was like, you
And
know,
what
Dad.
happened?
And I realized it's because his pee is
And-
probably going
and
here
some-
and their pee is going all the way
And
over
sometimes
there.
little boys have contests. How far can you pee?
That's
Yes,
right.
I remember that. Remember
And
that.
he-
I remember
Commercial on
that.
TV.
I remember that.
He loved it, and now I got it after a length
Yeah,
of
because
time
it
because
brought
he was
memories
so
to him.
old. His memory of being able to
To
pee
pee
long
like
distance.
2 blocks away. Now, you know what affects us? Men and women have estrogen and progesterone, and estrogen starts to decrease also in the men. So that starts to play a role about the size of the prostate. So those tissues become very sensitive because as we get older, we're decreasing the amount of estrogen in the male,
Yep.
and that affects the prostate.
The aging process.
Yeah, the aging process. But remember what we talked about?
Oh my gosh, yeah.
Smoking, heavy alcohol consumption, obesity, reduced activity level, hypertension if you have high blood pressure, diabetes, heart disease, and the Western diet are even bigger risks. Remember we talked about your grandfather? He probably didn't have any of this.
Mm.
No, and you know the thing that I'm learning is that
My grandfather was very thin.
yeah.
Because he was working and moving all the
and
time.
he worked until probably 90
Oh,
in
see?
the
God
farm.
bless him.
Yeah.
May he rest in
Yeah,
peace.
many
Yes.
was a busy.
Right.
Yeah.
Toxins are actually held in our fat. So
Yes.
the fatter you are, the more toxins you're holding on to, and obviously that predisposes you to a plethora of fatal disease. So it really is important to have a healthy body weight just to rid your body of those toxins.
Yes, I agree with
Because they will manifest themselves in the form of disease.
you. Yes, absolutely. Absolutely. So you think
We could be a tag team, you and me.
So listen, how common is benign prostate hyperplasia? I'm sure, you know, that handsome guy,
Yeah,
Cooney,
George-
probably might have some prostate problems. He married a young woman. It's very common. 60% of the men in their 60s have benign prostate hyperplasia. 40% have symptoms, and by the time that you're 80, 9 out of 10 will have benign prostate hyperplasia. So I'm sure that our
If you
friend
get to
here,
live that long.
what, 90?
If you get to live that long. You
To
know.
80, yeah.
Yeah.
Well, usually people now are living, the old are the ones that are 84 plus.
Mm-hmm.
You know, the young old is 65,
Yeah.
you know, up to 75. So we're lasting a little longer, but we want to be able to last healthier. So how do I know that I have benign prostate hyperplasia? Well, progressive urinary frequency is one of the signs. And you're getting up too many times at night to go to the bathroom, okay? Plus you're holding some urine, you're retaining, you don't feel like your bladder is absolutely empty, and you have this urge to go. In addition to that, when you try to pee, you don't have that stream you had when you were in your 30s. In addition to that, excuse me, the client usually comes in and say, you know what, I'm dribbling. And you'll see it sometimes on their pants, little drops of urine. So, yes.
Can holding in, I mean, it's obviously not healthy to hold in your urine. You know, you're
Right.
working and you can't get to a toilet, whatever. Could that also affect the prostate if you're holding your urine in? You know, you're a man at work and you're just not.
Well, they don't suffer from urinary tract infections like we do.
Right.
Because their urethra is longer.
But
and
does
our
holding
urethra's
in
short.
your urine?
Well, what that does is increases your bladder for more capacity. And sometimes we tell women you should try and see if you can hold on to your urine, because that'll help also with the contractions. You know, if we pee all the time, constantly,
Yeah.
then that also doesn't help for that bladder to have a reserve. Now, if you haven't gone to the bathroom for a very long time, sometimes that urine will build up to have bacteria.
Right.
It also
But the
depends
ur-
on the.
But does it affect the prostate holding in your urine?
It
is what
does, yeah.
It does.
It does.
It also depends on you know, on the weather. Like there's certain seasons
But you have to
that
go more
makes
than
you
the
go
half.
and have the desire to pee more than others. Like in the summer, you don't have that desire, but in the winter, it's like
Also, there's a couple
constantly.
of factors there. You're sweating, so
Right.
You're letting out this
Yeah.
fluid.
and in the winter, I always find if I'm feeling really cold, I feel like I have to use the bathroom.
Well, we all do.
Yeah.
You know, so it's different. It is.
So why do these symptoms happen? Well, you know, you have a thickened bladder, and as a result of the thickened bladder, you have frequent urination and urgency. And in addition to that, because your bladder is thick, right? Because that bladder is holding a lot of urine, right? You're going to pee more at night. In addition, because you have an enlarged prostate, it's going to obstruct the flow of your urine. So he really has to try to pee in that bowl. And also the urine stream is weak. They don't empty all the time, and then they have a little dribbling. So the need to urinate often, especially at night, becomes more prominent.
Now let me ask you this.
Yeah.
I have seen people in the hospital with very large prostate. I mean, giants.
This or the scrotum?
The scrotum.
The scrotum is different because the scrotum, there might be fluid or there might be a tumor. So if there's fluid, the scrotum will grow. And sometimes if we shine a light or do an ultrasound, we could see the fluid through. But if we don't see anything through the scrotum, it could be a tumor.
Which could be benign.
Well, until we do a biopsy, we
Right.
don't know.
Doesn't affect the prostate though?
Well, it's down here. It probably is affecting everything. So conditions that you might think that might mimic the prostate would be that the bladder is tight, so they might have a contracture. It could be scarring of the urethra because maybe there was some type of operation that they did, like an inguinal hernia, and maybe that affected it. It could be spasms of the muscle. It could be an overactive bladder. Like you said, I have to go to the bathroom all the time. If it gets cold, it could mimic but not necessarily be a prostate problem. It could be signs of bladder cancer. It could be if you're holding your urine, remember you said what happens? You can get cystitis. So an inflammation of the bladder can happen. It could be some neurological disease. For example, if you've had a stroke, if you have Parkinson's, that could also affect and mimic a prostate problem. And also diabetes type 2. And you know that as we get older, we have to watch our sugar intake all throughout our lives because we can wind up as we get older to type 2 diabetes, which was another thing that I wanted to talk about. But you know, diabetes also will affect the bladder.
You should do a talk on diabetes.
And diabetes for next time.
Yeah, because that affects
A
A
lot.
a
lot.
huge population.
Huge population.
Even if they're
I think-
pre-diabetic,
Yes.
you know?
Yeah.
And we're capturing the pre-diabetics earlier and earlier
Yeah.
by doing a hemoglobin A1C.
Mhm.
That's the best one. So what we ask specific questions is how many times do you go to the bathroom during the day? And do you go a lot at night? And do you feel that you have to go? And how is the flow of your urine? How's the force? Do you have to hesitate? Do you have to strain? Do you think your bladder is empty? Or do you feel it's still full? And have you had any prior episodes of having any retention? So these are some of the key questions that we ask. So one of the things that we do is we'll do a digital rectal exam to differentiate the difference between an enlarged prostate, and one that has adenocarcinoma or infection. A prostate that has cancer feels irregular, hard, and nodule, whereas the prostate should feel like the tip of your nose. Yeah, like that. We also do urine analysis to find out if there's an infection, and we also want to see how the kidneys are functioning from the amount of urine that you're holding. Is there any backflow? And we'll do a urine culture to find out if there's any infection, and we'll do the PSA if it's high to find out if there's any problems as far as cancer is concerned. And the PSA is done in selected cases, which means now the protocols have changed. If you're 60, it's a different number. If you're 50, it's a different number. If you're 40, it's a different number. We used to have one standard number, but now the guidelines have changed. All right. So this is some of the medicine, how we love to push it, but we have to do it. Medicine that can help with the prostate. We have the 5X reductase, which slows the growth of the prostate because it converts the testosterone into DHT in the prostate gland. You know, we also lower the PSA so that we have no occurrence of, you know, it might mask the occurrence of prostate cancer. And we also help with Proscar and Avodart, which that's what I wanted to find out if our friend was taking that, you know.
It seemed that he had been on some kind of herbal supplements, though he couldn't name them.
He couldn't name them.
But, you know, all those medications, I'm sure they do something.
Well, it helps with the growth.
Yeah.
You know, that it doesn't grow any bigger.
Yeah, but
than
it gives you
should.
something else.
These are the side effects. Decreased libido.
No man likes that.
No man likes ejaculatory dysfunction or erectile dysfunction. Or some of these medications will make them grow breast, gynecomastia. So you ever see these men on the beach that they have breasts?
Yeah.
You say to yourself, gee, maybe he should be wearing a bra. They might be on these medications.
Right.
And it also causes flushing, like we
Like
have.
a hot flash.
Exactly.
And you know, that's the thing. So what do? Do you take the pill and get all, you know, all these things that are really life-altering and very depressing?
Or do I sit home and pee all the time and not be able to have a life?
Well, the thing is, and I would never, and I'm certainly not a doctor or a nurse practitioner, but there are so many things that you could do with your lifestyle that changes everything around. Everything. So,
but we need to do those lifestyle changes early.
Yes. But, you know, God is so good to us. And He made our bodies to heal if you give them half a chance.
Yes. It's a perfect machine.
Yeah, it really is. But the problem with us, Americans especially, is we want our Arizona and pizza and nacho, you know, Doritos.
What's Arizona?
Arizona iced tea.
Oh,
You know,
Arizona.
the kids are 99 cents. You can get
Oh,
them in
yeah.
wherever.
So
Was
sugar.
it like 32 grams of sugar?
Yeah. Oh, yeah, it's probably even more than that.
Wow.
So, you know, that's why they're becoming ill, because the sugar causes inflammation.
But it's a big business.
It's a huge business, and they don't care about our kids
No.
or us, just their pocketbook
That's right.
in any event.
So let's talk about the medical management. And usually what we try to do is non-invasive. I usually give it sort of watch and come back, and let's see if it gets a little worse. And that's what we call watchful waiting. Okay, give me a log and I'll bring you back in 3 months. Let's see how you're doing, how you're coping. And if it gets detrimental, then maybe I should start thinking about pharmacological treatments and minimally invasive procedures and surgery, which would be shaving the prostate. And when we shave the prostate, it's called a transurethral resection of the prostate.
Sorry, but that sounds like that.
But they can pee. They're happy that they can pee.
I know, of course.
The use of herbs. Clients often use herbal agents in the belief that they are safer than physician prescribed, right? And we want to ask our client, are they taking the following? Saw palmetto has been helpful, crouch grass, the siwa, pumpkin, pygum, or any other preparation for pH sometimes has help. Not all the time,
Yeah.
okay? We still need the evidence-based literature and to make sure that these are helpful. But
Yeah,
some people find that
they're
they are.
part of a healthy lifestyle. They're not the solution in themselves, but with a lifestyle adjustment, it all adds up to the whole health.
hopefully you'll go to a urologist if things get out of hand and severe. And, like if you have severe urinary tract symptoms, that you're getting these urinary tract infections repeatedly, if you have recurrent UTIs, if you have bleeding, if you have a bladder stone, or upper urinary tract distress, which the urine is backing up. So they might say, well, we probably need, medication is not going to help. We're going to have to do some surgical treatment. And this is the operative treatment. They go in and they shave on D, if you see E, and they shave that prostate so that hopefully they'll be able to.
And
it's
look
a one
where
day
they go through.
they're anesthetized.
You won't feel a thing.
No, wait, you'll be medicated.
You won't feel a
And
thing.
it's a one-day thing, and you go home with a Foley catheter, and then you go back to the doctor's office the next day, and they'll remove it. I of course removed it from my husband's. I just took the Foley out. So bleeding,
Yeah, but
can occur.
he must feel so happy that you're.
So he says to me, "I'm not taking any medication," and I said, "Well, you have to take a baby aspirin every day. We all do, because that helps thins the blood." So I said, "Take a baby aspirin. It's only 80 milligrams, and that's it. And eat a healthy diet. Sometimes I have to check his sugar because he loves sweets."
Yeah. Well, everybody does. We're all addicted to it. Yeah. It's really important.
Yeah. So if you have a transurethral resection of the prostate, you're going to see some bleeding. Sometimes I hope that if you go to somebody good, infection can occur, or persistent obstruction, though that really happens. They could accidentally displace the catheter. What does that mean? Displace it. Put it in another area. It only goes one way, but if they displace it, then probably the urine is not going to flow because you have to have a little Foley bag. We could also make the urethra or the bladder even smaller. You can have inflammation of the testes, epididymiasis. You can have urinary incontinence, which means after we did this operation, you're going to pee on yourself.
I'm looking forward to this.
Yeah, but the thing is,
These are some of the
knowledge is
complications.
power.
These are some of this is not always, but these are some of the complications that patients have to be told about.
What is retrograde ejaculation?
It means that when they're having an orgasm and they're going to ejaculate, it comes right back up.
Oh my god.
And that's painful.
I'm going to tell Chris that one.
Oh my god.
You don't want retrograde ejaculation.
It's terrible. It's painful for them.
I'm sure it is. It sounds awful.
That sounds bad.
And they could have also erectile dysfunction. So prostate cancer, unfortunately, is the second most commonly diagnosed cancer in men following skin cancer. The number one cancer for both men and women is what? What do you think it is? For men and women, the number one.
Lung?
Lung cancer, correct. Prostate is the leading cancer related to death in American men. And of course, it's even higher among men who've had fathers who had prostate cancer and in the African American race. It's very big.
But is it treatable?
It's treatable. Everything is treatable
Yes, of course.
if I catch it on time.
Right.
Because then this cancer could metastasize.
Yeah. And remember, sugar feeds cancer.
Now, we don't know why cancer occurs. I mean, it could be unknown. It could be so many factors. But we know that men who have a history of prostate cancer are at a higher risk. Even 10% are believed to be inherited when we did the genetic testing. And the remaining 90 are classified as yes and no, sporadic. It could happen, it could not happen. So prostate cancer risk increases with age. African American men are at the greatest risk. Asian have the lowest risk of cancer. And there are, of course, dietary risks like we talked about before.
Are there any contributing factors as to why Asians have the lowest and African Americans have the highest?
It could be genetic.
That's very
With the
interesting.
African American male, yeah.
Hmm.
And we talked about dietary risk of having a good, healthy diet.
Yeah.
So early disease, sometimes they have no symptoms at all. They're fine. And then they start to have blood in the urine, painful ejaculations or semen, symptoms of they can't urinate. Sometimes the metastasis, which means the cancer that has spread, might be the first manifestation of bleeding, right? So early
Oh, wow,
diagnosis
that's
is
serious.
it is serious. So if he says to me, listen, I peed and there was blood coming out.
That's not a
Not
good
good.
sign.
Mm-mm.
So early diagnosis is always vital. We don't know if it was an obstruction, was there a stone,
And how often should a man be screened?
annually.
Once a year?
After-
Yeah.
Much like we have
At
our...
50, beginning annual, just like women have their pap smear. But with us, you know, if we have 3 consecutive paps that are normal,
Mhm.
right? By the time you get to 65, you don't need pap smears anymore.
Really? That's good news.
Yes. So this is the surgery that we do, right? Not I, but the urologist. And then we have a 3-way irrigation of the bladder, which means we're irrigating that bladder from what the doctor did as far as you know, shaving the prostate, and it filters through, and they come home with a little, it says catheter drainage bag, they come home with that little bag, and then we take the
He looks like he's awake.
he's awake, yes. My husband was in the recovery room, he was awake, and I went in there, I spoke to the nurse, I looked at the irrigation solution, I said, how's everything going? She said, fine. And then I said to her, okay, well, you know, he's ready to go home. And she said, yes, I understand you're a nurse, so this is when you have to take out the Foley. And he was fine, thank God.
So the catheter does get removed?
Oh, yes,
Yeah,
the
yeah.
catheter gets
It's
removed.
only post-surgery? just to-
Post-surgery, yes. We used to leave patients in the hospital for 2 to 3 days when I was a nurse. Now
Used to be in the hospital for a week if you had a baby. Now you're out the
Now
next
you're out
day.
the door within 3 days, and there was a C-section 4 days.
Yes.
Yeah.
Yes.
So interventions, what we do is we try to calm your fears, Sean, reduce your anxiety. We have
I have an oil for that.
We try
I
to
do.
talk about things according to your cultural background. We establish a professional and trusting relationship. We go with HIPAA, privacy. Allow you to verbalize how you're feeling about this. We reinforce information. We teach you, we explain to you, and we let you know that you have to be the one to decide if you want to go through the whole procedure, right? Now, what happens is sometimes if they go home and these devices don't work, we might have to do a little bit more, right? So when we have regained bladder continence, which means that they will come into my office and say, you know, even though I had this prostate surgery, I'm still dribbling. And it might take a while before the body gets used to its normality. So we tell you, number 1, avoid strains, no heavy lifting, no long car trips. Diet, make sure you have a lot of fluid, avoid coffee, alcohol, and spicy foods. And if you have any sexual problems, we will talk to you about it and refer you to a counselor. Right, but sometimes they will have this dribbling that can continue for a year. So they get very upset about that. All right? So we foster, again, open communication. We guide you. We validate that you're normal, you're not abnormal. We educate you. And again, we send you for counseling if you feel it's absolutely necessary to regain your sexual health. Because sexual health is given by God, right? So we want to continue to promote that through your later years. And that's